Over 1 billion people in some of the world's poorest countries are infected with a range of parasites and infections known as neglected tropical diseases. They cause suffering on the scale of HIV/AIDS, TB and malaria. Now a new programme coordinated by the World Health Organization and spearheaded by British experts from the Schistosomiasis Control Initiative are helping people in Africa receive drugs to overcome their infections.
They're mostly parasites, and they mostly infect, initially, children. Then, as the children grow up, the parasites develop and they cause more and more symptoms. It's a chronic, debilitating, disfiguring effect. And by the time people are 30, 35, 40 years old, they're suffering serious consequences. What we can do by getting the treatment to the children is that we get rid of the parasites, which first of all makes the children themselves more healthy. They're more likely to grow better and to be more attentive at school, but it's also protecting them in their future life from the serious consequences.
The neglected diseases include bilharzia, lymphatic filariasis, river blindness and trachoma. To tackle these, there's been a mass mobilisation, with pharmaceutical companies giving free drugs to distribute to 20 million people in 5 African countries. There's also been training for local people to administer the drugs and make sure different drug programs run at the same time to provide efficient treatment.
It's the first time that it's been done on an integrated situation like this. There have been 3 or 4 different programs that have focused on one only of the neglected tropical diseases. But what we've realized is that each of us are giving tablets to the same individuals on an annual basis. And so what we've done is we've come together. Now, obviously, logistically, that has increased the problem because you've got to get all the drugs in place at one time and you've got to get them delivered. And you've also got to treat the people using local community people who are trained. So you've got to do training and make sure that the people who are delivering the drugs give the right dose of the right drug. Those are the sort of logistical problems that we've had to overcome.
Over 20 million people have been given 4 different drugs to overcome the effects of neglected diseases. It costs around £5 million to administer the scheme, which makes it cheap to deliver the drugs. The goal is to eliminate 5 neglected diseases in 5 years. So far the initiative is showing positive results.
I believe that the children in Africa that have been treated have had a healthy start to life that they didn't have before. And we've been able to show that in adolescents and in adults, as a result of these treatments, anemia levels have gone down and people have improved their quality of life.
The work in Africa is seen as a blueprint of what can be achieved elsewhere if there is funding.
This isn't going to eliminate any of these diseases, a single treatment. What we've got to do is actually get these, there are 4 drugs and they're donated by the pharmaceutical companies who manufacture them. What we've got to do is get these drugs out to the people who need them on an annual basis over probably 5 to 7 years. What we can hope for in the countries where we're successful is that at the end of the 5 to 7 year period, these diseases will no longer be a problem.
With Britain pledging £50 million towards treating NTDs, the long-term aim is to roll out the programme to help millions overcome the impact of neglected tropical diseases.